I'm Professor Bob Millar, Director of the Centre for Neuroendocrinology at the University of Pretoria, which focuses on prostate cancer, led by myself, and breast cancer, led by Dr. van Bout. Prostate cancer is one of the most prevalent cancers in men, and in South Africa, black men have one of the highest death rates in the world. Currently, there's no systematic prostate cancer screening program in South Africa within the state-run healthcare system. And the available tests which are used are characterized by what we call high false positive and high false negative results. Now, high false positives mean that a man who does not have prostatic cancer is diagnosed as having prostatic cancer and then goes through various procedures which may even include surgery and do them harm when in fact they did not have the disease. And this, of course, is an unnecessary expense to the healthcare system. And the high false negative results lead to late or no diagnosis and poor outcomes for those men, because then they present with much more advanced disease later on. So our team is developing a novel state-of-the-art non-invasive technology measuring prostate cancer gene products. This is messenger RNA produced from DNA, tumor DNA, in the blood. And the test's been shown by our collaborators at Yale University to be much more sensitive and specific than existing tests, and over 90% accurate in Caucasian men in the US. So what we wish to do, our team, is determine whether the same prostate test, which measures 29 genes, and the NET test, which measures 51 genes, will be equally efficacious in South African black men, or whether we need to finesse these tests and modify them, tailor-make them, which we hope we won't have to do. We anticipate that our strong team of South African scientists and US collaborators will complete the studies in 18 months, and we anticipate we will be able to roll out this test widely in Southern Africa, thus saving lives and reducing costs to the healthcare system.
In the South African public health sector, women with hormone-dependent breast cancer can access only 3 standard chemotherapies after surgery. We know that a significant minority of these patients will not receive any benefit from these treatments. This can result in physiological damage due to unnecessary adverse side effects and psychological effects due to treatment failure. It also adds pressure on the health system, as it must deal with readmitted patients. This could be prevented if we had a tool which could predict whether patients would benefit from chemotherapy or not. Such prediction tools do exist, but they have mostly been developed in Europe and America using data from local patients. Possible differences in the genetic and physiological makeup of the cancer cells of patients of African descent could make these tools inaccurate here. At the University of Pretoria, we are constructing a biobank of breast cancer organoids from tumors removed during surgery. These samples will be used to test the effectiveness of chemotherapies. This will allow us to start to identify patients that may respond poorly to these drugs. From the samples of those patients that respond poorly, we will then extract genetic and protein information to construct a picture of the cancer cells that respond poorly. This information can then be used to identify other women who will not respond well to chemotherapy. In this way, we will be able to inform the treatment team to avoid using those drugs, thereby preventing unnecessary illness and hardship for these vulnerable women. To be able to test the drugs on living cancer cells, we will be making tumoroids, or also called tumor organoids, from the cancer cells removed during surgery. Tumoroids are living replicas of the tumor that behave as if they are still inside the patient. This gives us a window through which we can look at the behavior of these cells as we treat them with drugs. Other researchers will be able to make use of these living replicas to investigate and develop better diagnostic tools, more precise drug treatment decisions, and new therapies to treat those for whom standard treatments will not work.